I know many people wonder, what is hospice? Before I tell you what hospice is, let's address some of the myths about hospice.
Myth: hospice is a place for cancer patients. Many diseases reach an end stage. At this point, treatment and intervention no longer help the patient. The disease will not get better. Heart disease, lung disease, liver disease, Alzheimer's, and many more may qualify the patient for hospice care. With each diagnosis, there are guidelines for when hospice can be provided. Hospice is a wonderful service that helps many patients and their families.
Myth: hospice means I'm giving up. As a hospice, we do not want patients and families to give up. No one here is giving up on your loved one. If their health improves, we celebrate, and the patient is able to graduate from our program. Patients can discontinue services at any time. It is the hope of hospice that with our excellent staff, your symptoms will be well managed, and you can have more quality time with your loved ones.
Myth: you only have hospice care for 6 months. No, there is not a 6-month cutoff for hospice care services. Patients are reevaluated by their providers on an ongoing basis, and if the prognosis remains at 6 months or less, then hospice services continue.
Myth: hospice is a place you go. Some hospices have inpatient units. However, the large majority of hospice patients stay in their own home. Hospice also takes care of patients in nursing homes, some assisted living facilities, and other settings. Talk to hospice about what other options are available to you.
Myth: hospice makes you give up your doctor. No, Schneck Hospice wants you to decide which doctors you want involved in your care. After all, you have a relationship built with your doctor and nobody knows you like they do. Our Schneck Hospice medical director works in partnership with your doctor to provide orders when they are not available. Our goal is to keep the patient as comfortable as possible.
Myth: hospice is only for the last days of my life. The answer is no. Hospice is a benefit designed to help the patient and family as they go through the challenges of illness, caregiving, and grieving. Hospice serves you best when we have time to get to know you and your family. We want to be there for you, to answer your questions and to provide information and support in a way that is specific to you and your values. We believe in making the most out of every moment, and we are here to help you with that goal.
When is it time for hospice? When to begin comfort care is a very personal decision. For some, the time becomes clear when the burden of medical treatments outweighs the benefit. When hospitalizations, treatments, and side effects bring distress but no progress, it might be time for comfort care. Hospice works best when we believe a patient has months left rather than days, so that we can establish a relationship and provide support. Hospice is a choice, and you are always free to change your mind.
The one thing I think that I found most comforting and the most helpful to me was their professionalism, how they treated the patient and how they treated me at the same time. I speak highly about them. I would recommend them to anyone because everyone needs help at that time, and especially the family members who are left, not only to know what's going to happen to your loved one, but for yourself, it's a comfort. And I just appreciate them so much walking me through the process.
Hospice is a team-oriented approach to medical care, pain management, and emotional and spiritual support for a patient with life-limiting illness. Hospice is patient-focused while also supporting the family and caregivers, providing advice and education to lead them through the last season of life. The first step is to talk with your doctor about hospice care or call Schneck Medical Center Hospice to ask questions with no obligation.